Let's be honest, medical procedures could feel a little intimidating, right? So today, we are going to demystify the entire mammogram process from start to finish. Our whole goal here is to give you a super clear, step-by-step guide so you can walk into your appointment feeling informed, confident, and, totally in control. So, here's our game plan. We've broken it all down into 5 simple sections. We're going to start with the why this test is such a game changer. Then we'll get into the practical stuff, how to get ready for your appointment and what actually happens in the room. We'll even decode the results for you, and then we'll wrap it all up with the most important takeaways.
Okay, let's dive right in with the biggest question of all. Why is this one little test so incredibly important for your health?
It's a fantastic question, and the answer really boils down to 2 incredibly powerful words: early detection. Finding breast cancer early, before you can even feel anything, is truly the single most effective way to improve outcomes and ultimately to save lives.
And wow, look at this. These numbers from the World Health Organization tell such a powerful story. In countries where early detection is common, the 5-year survival rate is a staggering 90%. Now compare that to places where screenings aren't as widespread. It's a huge difference. This isn't just a bar chart. This really represents the incredible life-saving power of this technology.
And mammography? Well, that's the tool that makes all of this possible. It's basically a specialized low-dose X-ray that's designed to see tiny changes in the breast tissue, things that are way too small to be found otherwise. It gives doctors a head start, and that can make all the difference. Okay, so knowing the why is half the battle, right? Now let's get practical and talk about the how. A few super simple prep steps can make a huge difference and help your appointment go as smoothly as possible.
First things first, it's helpful to know which kind of mammogram you're scheduled for. Most of the time, it's a screening mammogram. That's just your routine checkup when you don't have any symptoms. But if there's a specific concern, like a lump, or if something looked unusual on a screening, then you'd have a diagnostic mammogram to get a closer look.
And here it is, your super simple prep checklist. 4 easy things. First, try to schedule your visit for the week after your period. Your breasts will likely be less tender then, making it more comfortable. Second, just a practical tip, wear a top and a bottom so you only have to take off your shirt. Now, number 3 is a big one. Skip deodorants, lotions, or powders that day. Why? Because some of them have tiny metallic particles that can actually show up on the X-ray and look like something they're not. And finally, if you've had mammograms at a different facility, bring those records along. They are so helpful for comparison.
All right, now for the part I know many of you are curious about. What actually happens once you're in the exam room? Let's walk right through it.
The whole thing is surprisingly quick. We're talking about 20 minutes, more or less, from start to finish. So let's break down exactly what to expect in that short amount of time.
It's really just a straightforward 3-step dance. And you are not alone in this. A trained technologist is right there with you the whole time. First, they'll help you get positioned correctly. Then, a clear plate comes down and flattens the breast. This is the compression part, and it's absolutely key for getting a clear, high-quality picture. It only lasts for a few seconds, and then, zap, the image is taken. They'll do this from a couple of angles for each breast, and then you're done.
Okay, let's just go there. The question on everyone's mind, and it is a totally fair question to ask. Does it actually hurt?
And the honest answer is that for most women, it's more like a brief moment of pressure or mild discomfort, not sharp pain. That compression part is so important, but remember, it literally lasts for just a few seconds for each picture. The key is to communicate. If you're uncomfortable, just tell your technologist. They're there to help you.
All right, you did it. The test is over. So what happens next? Let's talk about getting your results and making sense of what they actually mean.
So your report is going to have a number on it, from 0 to 5. Don't let the numbers scare you. It's just a standard way for doctors to communicate. A 1 or a 2? That's fantastic news. It means everything is normal, or there's a benign finding, and you just come back for your next routine screening. As the numbers go up, it just means they might need a little more information, maybe another picture, or in some cases, a biopsy to be sure.
Now, I really want you to hear this next part. If you get a phone call asking you to come back for more tests, please, please, please try not to panic. This is actually pretty common, especially if it's your first mammogram and they don't have any older images to compare to. The vast majority of these callbacks turn out to be absolutely nothing to worry about. Okay, we're in the home stretch. Let's wrap things up by tackling a few more common questions and then summarizing the absolute most important things to take away from all this. This is all about you and your empowered health journey. Here's a little rapid-fire Q&A for you. When to start? For most women at average risk, age 40 is the magic number. How often? Usually every 1 to 2 years. What if you have implants?
totally safe. Just make sure to tell the clinic when you book. And during pregnancy, it's typically avoided, but if it's really needed, it can be done safely with extra protection. So if you remember anything from our chat today, let it be these 5 things. Number 1, early detection saves lives. It just does. 2, prepping is easy and makes a big difference. 3, the whole test is fast and the discomfort is brief. 4, don't panic over a callback. It's common and usually benign. And finally, and this is the most important one, you are the #1 advocate for your own health. And we'll leave you with this final thought, which really is the whole point. Early detection is, without a doubt, your most powerful tool. Taking charge of your breast health is one of the most important things you can do for yourself.
So I'm going to leave you with a question to think about. What is one small step you can take today to manage your breast health? Maybe it's scheduling that appointment you've been putting off. Maybe it's talking to your doctor. Or maybe it's just sharing this information with a friend or family member. Whatever it is, taking that step is what really counts.